So, continuing our conversation, we were talking about neuropsychological testing the last time we met. And one of the things that neuropsychological testing does, it gives us a treatment plan. And then what we can do is we can start to integrate some of the treatment plan with some of the other treatment modalities. Um, what are some of the psychotherapy modalities that are available uh, for teaching a child who has PANS and PANDAS skills?
So there are basically three different approaches that can be helpful, probably at different points in the course of the condition, and those are center around cognitive behavioral therapy techniques. We can talk a little bit about CBT and kind of what that looks like and what the goals are. But also, there is work outside of individual cognitive behavioral therapy that can be done. So, working with parents or other caregivers or teachers to provide them with support and education around the syndrome and ways to help. And then there's also family therapy that can be done, which can also incorporate caregivers, but also a child or individual, and focuses more on the systemic processes and communications within the family. So there are several different ways that we can intervene and support a child or individual and their family.
So, when is it a good time to think about psychotherapy? When should a family or a child consider it?
So a lot of it's going to depend on symptom severity and how much they've progressed in terms of getting the other pieces of the treatment plan up and running. The reason I say that is because for certain types of intervention, there is a certain degree of stress tolerance that's required. So the individual CBT is a very direct intervention that involves, the main focus is on a child. Family may be there too, but that does require a good amount of stress tolerance to be able to sit or stand or walk or sit on the floor in a room, but to focus on some materials that teach these skills that CBT's meant to focus on. So there's got to be a certain level of tolerance there. Prior to that, though, very early on in the treatment piece, you can go ahead and start working with parents and caregivers to understand the condition, to understand the symptoms and how to recognize those and how to respond to them, because definitely traditional parenting strategies do not work with certain symptoms of PANS, PANDAS. In fact, they can even, parents can sort of be, doing everything that they've, done before or know how to do with, and have great parenting skills. But because of the nature of the symptoms, they can worsen, and that can be very frustrating for parents who just want nothing more than to support their child. To prioritize what a child would be focusing on. So sometimes there are different areas that are a challenge. And rather than working on everything at once, it's important to kind of say, hey, what would be the most impactful, or what what difficulties or issues might prevent us from working on other things that a child needs to work on. So, for example, if there is aggression as part of the syndrome, that might be a primary target of either parenting support or family therapy if family dynamics contribute to that.
So, the way that I think about it is um, how family therapy needs to be there for any treatment to work. Even giving medicine to a child sometimes requires a certain coordination of the family to be able to give it in the morning or in the evening or in the form of pills or so there are different components to the psychotherapy. One of the questions that I most commonly hear and has been actually researched quite a bit is this cognitive behavior therapy. And parents ask, what is cognitive behavior therapy? How can that help my child?
So cognitive behavioral therapy has two sides to it, cognitive and behavioral, and they dovetail with one another. The cognitive piece of CBT involves looking at the way someone views themselves, others, aspects of their environment, expectations of the future, memories of the past, different beliefs that have been formed over time, and the way in which those beliefs inform how a person responds to themselves, to others, to part of their world. And the cognitive part deals with being able to modify or assess and modify those beliefs in a way that's realistic, in a way that fits the evidence that a person might have acquired through experience, through feedback from others, through input, through education, and sort of gathering all that evidence together and then kind of looking at what that points to. And if we're able to modify certain beliefs or thoughts that may be distorted by symptoms of anxiety, depression, stress, and come up with some thoughts that are maybe a bit more realistic, a bit more true to life. So once we're able to do that, or as we're able to do that, we also want to look for behaviors that fit these more realistic modified thoughts. So, behaviors that are realistic are going to address realistic demands that exist in a person's world. So being able to match those behaviors with the new modified thoughts, and learn the interplay between those thoughts, those behaviors, and then the feelings that come with them. That is often referred to as the triangle of CBT. So developing awareness of how your thoughts, your behaviors, and your feelings are all interrelated can give someone a great sense of power and control and self-awareness. So those are the skills and abilities that we're looking to strengthen through CBT. And in the case of PANS and PANDAS symptoms, often the type of cognitive behavioral therapy that's used is known as exposure and response prevention. So that extends kind of the CBT model to directly address cognitive obsessions and behavioral compulsions by looking at the link between those and interrupting the compulsion, preventing the compulsion, as not a realistic or practical response to an obsessive fear or worry. Being able to accept that the fear or worry exists, but knowing that a different behavior might be much more appropriate to address it. Also noticing when the fear or worry often does not result in a feared outcome. And being able to stay in a situation that is worry provoking, and being able to stay in it for long enough to have an anxiety level or frustration level drop, and then to realize that the feared outcome itself didn't happen. That provides for less activation the next time a person enters that same situation.
Ripple effect of this illness is huge, not only in a child's life, but their family life, the parents' life, the parents' ability to get along together, their siblings, their teachers, the community. It's big, but there is hope. We can continue to work through it and support the children that go through this, and support the families that are in charge of their health. We'll talk again soon.
Thank you, Dr. Javed.